MRI shows anatomy. An MRI does not show pain. We have no imaging test that demonstrates where the pain is coming from. All we can see is what the anatomy looks like. We've done studies of asymptomatic volunteers, and as people get over age 50 or so, at least half or more are going to have findings on their MRI, and these are people with no symptoms at all. So if you take a person with acute low back pain who's 50 years old, there's at least a 50% chance there's going to be some, quote, abnormality found on that study. The effect of that can be profound. If you have someone who has a acute low back pain, which is going to be a self-limited problem, now has a medical diagnosis of, say, for example, degenerative disc disease. That changes their approach to dealing with the problem. All of a sudden, they now have a, quote, disease, whereas in fact, they have back pain and an MRI that shows the normal aging process in the lumbar spine.
The descriptions can be very scary because they're usually very thorough. They can say things like facet arthropathy and grade 1 spondylolisthesis and disc desiccation, and patients will get a hold of that, and then they go to the computer and look it all up on the internet, and most of those things are probably pretty typical findings for anybody over the age of 30, but they don't necessarily know that. And so if you get an MRI and start to interpret all these things on the computer, you may create a monster in your head. There's this horrible thing going on, and that's very scary. Whereas if you don't need to have the MRI, you haven't gone there. And you don't really need an MRI unless you've got a worrisome finding like a nerve-type pain, a fever, an infection, weight loss, things that might make us worried that you have cancer or a fracture or a tumor or an infection. And those are actually pretty uncommon.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.